Hello, my name is Jackie Short. I'm the Clinical Director of Sydney Centre for Creative Change, and I'd like to welcome you to this, our 10th webinar in the Holding Space for Self and Others series. Today, we're focusing on animal-assisted therapy, and I'd like to welcome Jay Anderson in just a moment to facilitate this webinar today. I'd also like to acknowledge the traditional owners of the land that I come to you from today, the Eora people of the Gadigal Nation, and pay our collective respects to elders, past, present, and emerging. I'd also like to welcome especially our Indigenous brothers and sisters and colleagues who'll be joining us today. Welcome one and all. This is our 10th Holding Space for Self and Others webinar today, and after our presentation on animal-assisted therapy from Jay, we're going to have about 5 or 10 minutes in the chat in small groups with others who are here today to talk about this presentation and how it might have relevance for the work that you're doing in the spaces that you're working in. Then we're going to have a prize giveaway at the end and we'll wrap up. So we'll be here for about an hour together today. I'd like to welcome the psychologist, counsellor and play therapist supervisor and friend of mine, Jay Anderson, who has been working very actively in this space of helping others and making a difference for over 25 years now. She's based in the southwest of Western Australia, and she works with children as well as adults. And her strong interest in animal-assisted therapy has seen her working with her dog, who I'm sure she's going to introduce us to, and she's going to share with us now what this field means to her. So without further ado, I'd like to welcome Jay for your presentation today.
Thank you, Jackie. It's good to see everybody here this morning. Just getting my presentation. Good to see the different places people are coming from and how the weather is there. I got to see the sunrise this morning, so I was very happy. So today I'm wanting to share with you a little bit about making a difference and helping everyone understand animal-assisted therapy. And in particular, I want to focus on animal-assisted play therapy because that is one of my professional interests. This picture here is my first therapy dog, Kel, who I had about 7 years ago now. So today I want to talk a little bit about relationships with animals and relationships with our clients. And we're going to share a little bit about the different definitions in the field and then talk more specifically about animal-assisted play therapy. This is a picture of my dog, Jen, in a session with a child. So basically, animal-assisted therapy comes in under a category of animal-assisted services. So later, if you've got time and you've got some particular interest in this field, I encourage you to have a look at the website animaltherapies.org.au, which has a really good definition of the 4 different types of services that come in under animal-assisted services. So I'll outline them to you. They are animal-assisted therapy, animal-assisted learning, animal-assisted activities, and assistance animals. So that website has a really good definition of each of those categories. We're going to focus specifically on animal-assisted therapy, so one of those 4 categories, and then talk more about working with children, in particular around animal-assisted play therapy. So animal-assisted services are well known and researched in terms of being an effective pathway to help prevent and manage mental illness, disease, disability and suffering for many, many people around the world. In terms of animal-assisted therapy, I've highlighted some keywords in this definition. So basically, it's a goal-directed intervention where an animal is incorporated as an integral part of the clinician's healthcare treatment process, and it's delivered or directed by a professional health service provider who has skills and expertise in relation to applying human-animal interactions. And here's a picture of my dog, Jen, in a session with a child. The other definition that I like to use is the Pet Partners Delta Society definition, which talks a little bit differently about how it's a goal-directed intervention where an animal meets specific criteria, and it's delivered by a health provider who works within the scope of their profession, and it's designed to promote improvement in the functioning of that client. This is a photo from one of the trainings that I participated in a few years ago with some other play therapists who were interested in animal-assisted therapy. So in particular, I want to focus on animal-assisted play therapy. So ultimately, that is the integrated involvement of animals in the context of play therapy, where appropriately trained therapists and animals engage with clients through playful interventions with the goal of improving their clients' developmental psychosocial health while ensuring that the animal's well-being and voluntary engagement. So Risa Van Fleet said that play and playfulness are essential ingredients of the interactions of that relationship. And there's many animals that are utilised within the therapeutic relationship, more commonly dogs and horses, but other people also use cats, rabbits, guinea pigs, a range of different animals. Here's another picture of my dog in a session with a child. In terms of working with children, the Association for Play Therapy has talked about a definition for play therapy. So I was just wanting to share a little bit, if we're talking about animal-assisted play therapy, first we need to understand play therapy. So play therapy ultimately is using a theoretical model in an established interpersonal process where a trained play therapist uses the therapeutic powers of play to help their clients prevent or resolve psychosocial difficulties and to achieve optimal growth and development. So the key to remember there that play therapy is using a particular model. Okay, so when working with children, there's a number of ways that therapists work with children. So predominantly there's either working directly with the client, there's therapist-directed approaches, there's child-directed approaches, and there's collaborative approaches. This is a really good slide that Jackie and I used in a presentation we did at the Australian Childhood Foundation Trauma Conference a few years back, which was adapted from Stagnetti and Parson, which shows across the bottom the main different models of working therapeutically. And you can see there's psychodynamic models, humanistic models, systemic models, attachment models, and emerging models. And up the top there, there's a lot of different names of different play therapy models. And I've highlighted in red a couple of the different models that I utilise in my work, and that involves my dog Jen as well. So I've got child-centred play therapy and the play therapy dimensions model. So I just wanted to highlight that. Some of you might be familiar with some of these different names of play therapy models. So animal-assisted therapy, in terms of animal-assisted play therapy, is the integrated involvement of animals in the context of play therapy, where an appropriately trained play therapist engages with an animal within their client session, primarily in play interventions. And Risa Van Fleet, who made this quote in terms of this definition, said that play and playfulness are essential ingredients in this relationship. This is a picture that a child drew of my first therapy dog that I just wanted to share with you. So ultimately, animal-assisted play therapy involves a playful process in the context of a relationship where clients are assisted to gain mastery over challenging areas of their lives, and that allows lasting change to happen. And this is a really nice quote that I came across, that everyone can help someone. So there's some core principles of animal-assisted play therapy, and these are some similar principles in terms of what we would utilise in therapeutic relationships, in terms of respect, safety, acceptance, involving the relationship, but also to remember the importance of choices, not just for your client, but for your animal as well. The importance of training, the importance of having strong foundations in understanding the work itself. It's another photo of my dog Jen in a session with a child, just watching him do some drawing. And this is just reiterating those guiding principles. And I just wanted to highlight, particularly in relation to the therapeutic relationship, often we're interacting directly with our clients. In terms of having an animal in the room, it means there's another relationship that you need to consider, and that is your animal. So it's about keeping an eye on and being aware of your animal's body language as well as the child, and then you've got the interactions between all three in the room. Another picture of a child interacting with my dog Jen. So within animal-assisted play therapy, there's a number of goal areas that you would work with in terms of engaging with your client and setting goals. So it could be around self-efficacy, could be around their attachment and their relationship. Another photo of an animal assistance dog in therapy from my supervisor in America. Some other goals might involve helping your client with empathy or with self-regulation. You can see here my dog paying close attention to what the boy is showing here. And the other goals areas could involve resolution of different particular problem areas. So for example, children that might have experienced trauma, children that might have anxiety or particular fears. This is a photo from one of my colleagues who is an OT who utilises her therapy dog in particular in OT sessions. And I'm talking mostly about engaging with dogs in play therapy, but obviously there's lots of people who engage with horses, and there's a whole nother world and a whole nother world of research and talks around utilising equine therapy. And another really lovely picture of a different dog engaging with a child. So we're just part way through my presentation, just in terms of a little bit of a summary. We've just talked a little bit about animal-assisted play therapy and play therapy, engaging with child clients. And now I'm just going to shift a little bit in terms of talking and giving some information about specific training and certification in case people are interested in that. So this is a presentation that I did at the Animal Therapies Conference earlier this year, where I combined with Risa Van Fleet to share in particular about the International Institute for Animal-Assisted Play Therapy. Then we're going to talk a little bit about the International Institute and the particular training process and certification program. So the International Institute for Animal-Assisted Play Therapy was developed in 2004 by Risa Van Fleet. Prior to that, animal-assisted play therapy has been utilised for around about 30 years in terms of being documented. So Risa Van Fleet saw a gap in the profession and a need for a particular training and certification around animals in play therapy. And she has been holding on-site training in different countries. So particularly in Australia, Risa Van Fleet came out in 2016, and there's been a number of courses run in Australia since then. Here's a photo of some of the course participants in 2017. So ultimately, there's a particular certification process where there is training undertaken over at least a 2-year period. There's significant online modules and assessments, and then there's 2 on-site programs, which are 4 days. And people who have done the program then participate in regular supervision classes where they share case material and they discuss their clients and animal-assisted play therapy. It's another photo of an animal in their play therapy session. The other thing that's really important to consider and that you would learn more about in your training is the domains in terms of the animal relationship with the therapist. So there's the importance of the partnership and having a strong engagement. There's important communication and attunement. It's important to have respect and appreciation for your client as well as your animal. The importance of spending time together. So it is about your relationship with your animal outside of your sessions as well. And then the importance to have structure and plan ahead and attending to your client as well as your animal's needs. Another lovely picture of a child interacting with a dog in therapy. So in terms of the training, there's particular competencies that are focused on. So there's animal-related skills, there's animal-assisted play therapy skills, and there's the focus on the relationship. And I thought it would be interesting just to share with you the different levels of certification. So there's an animal-assisted play therapist, there's a professional practitioner in animal-assisted play therapy. So that might be a counsellor or a psychotherapist, but someone who doesn't particularly have play therapy qualifications. Then there's an associate in animal-assisted play therapy, and then there's canine and equine support specialists. So you can see there's a wide range of professionals engaging in animal-assisted play therapy. And Risa and her colleague Tracy Thompson produced an excellent book, which I can highly recommend if you're interested in this field. So I'm just going to shift a little bit from talking about the International Institute for Animal Assisted Play Therapy and bring it back to Australia in terms of thinking a little bit about if you're interested in this field and connecting in with other people. There is a new organisation that was developed in the last couple of years called Animal Therapies Limited, which ultimately is an organisation wanting to act as an umbrella organisation to connect people and to help clients know where to find animal assisted therapists and those other categories of animal assisted services. So as I mentioned earlier, there was a conference this year and there will be a conference next year planned to be in February in Adelaide. And of most interest to everybody would actually be the national directory. So you can go to this website and you can look up different states and different areas and find animal assisted therapists or other services within the animal therapies world. Here's an example of the animal therapies organisation. So you can see on the left there, animal assisted service providers with animal assisted therapy, animal assisted learning, animal assisted activities and assistance animals. So in conclusion, we've had a look in this presentation at the importance of animals engaging with humans in therapy. We've talked about the relationship and the importance of the therapist-animal relationship, as well as the therapist-client relationship, and considered animal-assisted play therapy as a therapeutic tool for engaging with clients. And I wanted to highlight the importance of training and registration. So we've talked a little bit about the International Institute as well. And there's one of my favourite places and pictures of my dog and I in nature. Thanks, Jackie.
Thanks, Jay, for a really informative presentation and introduction to the world of animal-assisted therapy. You have a lot of information there for us, and those slides will be available on our website a little bit later on today if you wanted to download and read through those in any more detail. I know many of you would have questions for Jay about this field, potentially about how she uses her dog in therapy with children or with adults even, training that she's done or other training pathways. So if you do have any questions that you'd like Jay to answer, we're going to have a couple of minutes now for those. So just type those into the chat box, I'll read those out. And if you want any further kind of articulation of your question, we can unmute you as well. So just type your questions into the chat, and I know Jay is keen to stay online and answer any of those questions. She's got a lot of experience in the field and is really happy to be here today and share that wisdom with us. So if there's anything you'd specifically like to know, just while we're waiting for those questions to come in, Jay, can you talk a little bit about, maybe in light of COVID, are there any particular challenges in working with animals at this time?
I guess ultimately the last few months, the main experience we've had is a lack of people coming in. We've still been working in Western Australia, so it has been a range of phone appointments, Zoom appointments, and a few people face-to-face still. So certainly from Jen's perspective, it's been very quiet and maybe seeing one child a day instead of several. But in terms of interacting with our clients, we've still been interacting with children and with adults in our practice here.
Okay, fantastic. There's a question here from Violet. Could you please share with us some examples of AAPT? Would be amazing if there are some videos. I'm sure if you've got it.
I'm not prepared to show videos today. We could certainly do that another time in terms of more in-depth case material. But in terms of engaging with a dog in animal-assisted play therapy, I've been doing that for about 7 years now. And for me, it's really amazing just to see the difference in that relationship with children, aside from them being happy in our relationship in terms of a therapeutic relationship, their extra excitement and enthusiasm of participating with the dog in the room. For me, often my dog Jen is involved in child-centred play therapy. So in that situation, she will often be lying in the room watching what the child's doing. Often she will be close by to a child or at a distance, and some children like just to know that she's there, and other children will actually go over near her and play next to her, or some children like to interact with her. I have a sand tray with symbols set up in my room as well. So often Jen will be lying on the couch right next to the sand tray, and some children will, as they're exploring the symbols, come and show her symbols, which is really lovely to see as they come over with something. Sometimes they put symbols down next to her, and sometimes they want to interact with her in terms of playing with her. I guess for me, one of the funniest things in terms of interactions is using bubbles in the room. So most children really enjoy bubbles, but Jen absolutely loves bubbles and gets very excited when there's bubbles around, which is very playful and fun for everyone because we all end up laughing.
Beautiful. Thank you. Another question that we've got coming in this time from Jennifer. I'm wondering how you manage the welfare of the animal with children with behaviour problems and potential aggression.
Ultimately, it's about planning your sessions and planning what children are appropriate to utilise your animal in sessions with. So part of that is around undertaking your parent consultations first in terms of meeting with the parent and learning more about your child that you're going to be working with. Not all children are suited to animal-assisted play therapy, so it is just about keeping note of what particular ways you would be working with that child and deciding what therapies you would use and whether that would involve animal-assisted play therapy. In terms of working more specifically with children who might have challenging behaviour, some children don't show that challenging behaviour in the therapy room. It could be related to a particular environment. And ultimately it is about setting limits and having boundaries in your session so that you can talk to your child that you're working with around what's okay and what's not okay, and helping make sure that they know that your animal has its own space and its own choice too. Your animal might not choose to interact with them, or if they come over to play with it, might not be interested. So it's about helping them understand that your animal is a living being with feelings and with the ability to make choices as well.
Lovely, thanks Jay. Question here from Simone. I'm wondering about using the client's own animals as an adjunct to therapy. Is there a good way of encouraging parents to facilitate this at home in between sessions?
That's a really good question. Ultimately, again, it's about thinking about the appropriateness of that animal and how it interacts with the child. Certainly you could talk with the parents about the importance of that relationship, and maybe the family might also be interested in learning a little bit about animals. If it's a dog, they might be interested in learning a little bit more about dog body language, and helping them be more attuned to their dog's body language and their interactions between them as humans and their animals, because there are lots of people who have animals at home but who might not be fully aware of their dog's body language and its communication with them as well. So you could help them be more attuned to each other in their relationships.
Thanks. The next question is from Katie. How are the animals chosen? Do they have to be a certain age, temperament, breed, and who trains them?
That's a really good question, and there's lots of different views on that. So in the training and the course that I've done, ultimately it is about getting to know your dog or your animal, and working with them and knowing their strengths and their limitations. And ultimately it's about tailoring your therapeutic work in terms of what is best for your animal and your therapeutic work. In many areas, it doesn't matter what animal you choose, it's about the animal's personality and their understanding of the work that you do. So there's no particular breeds that are better. Lots of people do have smaller animals or animals like poodles, but there's lots of different animals that are well suited to working in therapy.
I think that leads us nicely into the next question from Rebecca, who's getting a puppy soon and longer term would hope that they could be involved in her therapy work. Any tips on anything specific to do from the beginning, or when you might look at starting training?
I guess there's two things there. One is training of your animal and one is training of you. So I would really encourage you to look up Risa Van Fleet's International Institute for Animal Assisted Play Therapy and start doing some training yourself, because there is a lot of online training that you can do. And like I said, the training is like a 2-year process, which means you can start doing some training now. You can do some training in understanding communication. You can start spending time with your animal and getting to know them. And again, there's the training of your animal. So going to puppy classes and going to obedience classes and helping them start to learn our language, because it is, we've got two different beings and two different ways of communicating. So it is about them getting to understand you and what's expected and us understanding them. In terms of what I did with my dogs when I've had them both as little puppies, is having them in the therapy room in a beanbag, or in the corner in their space, and helping them be familiar with the environment. But the main thing I think to remember is giving animals choices and making sure that you're meeting their needs. So, for example, often as a therapist, you might see clients in terms of appointments at 9 o'clock, 10 o'clock, 11 o'clock. You might not have much of a break as a human between clients, a toilet break or a bit of a walk around. But when you're engaging with an animal in therapy sessions, it's really important to remember that you've got another being that has needs, that needs to go for a walk, that needs a break. And so it's really important to structure your day so that you have lots of breaks and so that you're able to meet your animal's needs as well as your needs.
Thanks, Jay. Really practical advice. A question from Karen, who's doing her certificate in animal-assisted psychotherapy, wants to know the difference between this and animal-assisted play therapy.
So animal-assisted play therapy is ultimately engaging with an animal in play therapy. So as I explained in my session, it's about the therapist either being a play therapist or understanding play therapy. So there are different levels of understanding play therapy if you're a psychotherapist or a counsellor. So it's utilising one of those play therapeutic models and engaging with your animal in that process, whereas psychotherapy as a field is broader than animal-assisted play therapy. And so you might be engaging differently because of the different theoretical models and the different training that you're utilising.
Thanks, Jay. This question from Sarah is about insurance, and I know certainly insurance is different across our different geographical jurisdictions as well as professional jurisdictions, but she would like to know if you have particular insurance to use animals in your work.
That's a really good question in terms of insurance, and it does depend on where you are, what country you're in and what state you're in and what profession you're in. So I really encourage you to have a chat with your insurance company about including animals on your insurance, or you might need to get extra different cover to do that.
Violet has asked a question about if your therapeutic animal was to die suddenly, what problem could occur and how might you handle that?
That's a very close to home question, because my first therapy dog did die very suddenly. And so I guess there's two components. Part of it is you managing your own grief and resolution around that, and then helping the children that worked with your animal around that. So for me particularly, it was about explaining that to children. Some children wanted to do a drawing. I developed a special little book about it as well. And I guess in terms of transitioning and engaging with another animal, everyone's different in terms of how they grieve and manage loss. For my husband and I, we decided on the day that our dog died that we were going to get another dog, because she was such an important part of our lives. And for me, a part of my professional life as well as my personal life. So we actually got a dog a week later, and she was able to then transition in with those clients that I was working with and begin learning about therapy and play therapy over time. So everyone's different. Ultimately, it's about helping your clients and work through their grief and upset around not being able to engage with the animal that you had originally, and yourself as well. So lots of things to consider.
Thanks, Jane. A practical question from Shawnee, and we might finish with this one. When my dog yawns, she asks my dog yawns when he gets attention. I looked up what that meant and found it meant he's anxious, but he doesn't seem distressed. How might you read that dog expression?
It's a really good question. And I would say sometimes a yawn is a yawn. Sometimes we yawn because we're tired or because of the lack of oxygen around, or whatever the physiological reason is for a yawn. And sometimes it is directly related to something stressful or a change. So it's about noticing your dog or your animal and the context they're in and what just happened. So it might have been that you did something suddenly, or it might have been something that surprised your dog, or it might have been that they were just yawning.
Okay, thank you, Jane. And thank you for all your questions and participations in that. I think that's the most active chat box use we've had of questions in all of our 10 sessions so far. So it's obviously an area of keen interest for people. Jay, thank you very much for that presentation. And I'm not sure, Jay, if you'd like to stay online and participate in some of the breakout rooms, you're more than welcome to. It'd be great. I'm sure whoever you're in a room with shortly is going to be very privileged. But I am going to automatically just create some rooms now for you to have a small chat with 2 or 3 other people. So you had some time in those small groups to have a think about how this work with animals might impact on or influence the practice that you're doing. So welcome back, everybody. Would anybody like to share? I can see, Rhonda, you're there with one of your lovely feathered friends. It's nice to see some of your assistants potentially with you at the moment. Would anyone like to share and reflect on some of the things that you might have been talking about in your groups just now? Maybe just give me a wave and I'll just invite you to unmute. Rhonda, yes. Do you want to unmute?
We were discussing it, animals as transference objects. Like, people find that can just immediately speak to animals more so than a person.
And is that something that you've found in your practice?
I'm not practicing yet. I'm in second year masters and in placement. So 6 months to go.
Great, good. Keep up the great work. Excellent. So animals as transference objects who might be easier to connect with, to have relationships with potentially than humans, but a starting point for that, a way of developing, connecting with others. And some of the things that, Jay, you were reflecting on before spoke to me a little bit about that too, about being able to respect animals' spaces and choices if they didn't want to engage with us, and being respectful of the way that they might want to connect with us. Do you want to maybe speak a little bit about your understanding, Jay, of animals as transitional objects?
I guess I heard that question 2 ways. So yeah, certainly in terms of transitional objects, in terms of clients engaging with animals definitely helps them engage in therapy. So there's an extra level of interest, and there's an extra relationship there, really, and I think that's really important. And I also do that question in terms of transference. If you think about transference in a counselling world in terms of that extra level of information that happens at a subconscious level. There's certainly really interesting talking, particularly with equine therapists, but also with other animal therapists, about the animal's interpretation of the energy within the space and how animal engages with us as humans around our body language and our communication as well is really, really interesting.
Wonderful, thank you. In 2 weeks, our next free presentation will be with the very special Mary Jo McVeigh, who some of you might know is a trauma specialist, a social worker and fabulous counsellor who works at Cara House in Sydney and runs programs for young girls and boys who have been affected by trauma in different ways. And she's going to be talking about finding ethics in the time of COVID. One of her great passions is working for children's rights and their well-being. And she's doing a PhD at the moment on giving children choices therapeutically and in terms of casework. So she's going to do a great presentation for us in 2 weeks at the same time. So hopefully you can join us then. We've got some other ones coming up, so you can check out the website and the bookings for those. Feel free to book in for any of those you'd like to, and the recordings will be up usually about a week later. Also to let you, sorry, yes. Yep.
It's Lisa. I just noticed it says 8th of June. I think it should be 8th of July.
Oh, thank you very much. That is a typo. It is the 8th of July.
Mary uses animal-assisted therapy, so anyone who's interested in that may find that interesting.
Fantastic. Thank you, Ta. Thank you all for being here. Lovely to see you. Keep warm and well snuggled with all those lovely soft things in your lives, and look forward to seeing you hopefully in a couple of weeks for our next webinar, if not before. Take care, everybody. Bye now. Thanks again, Jay. Fabulous presentation. Really informative. Thank you.